What is up, everybody? Welcome to the Movement is Medicine show, and I am rocking out today with Dr. James. What is up, my man?
What's going on, Barry?
Hey, how you doing?
I'm doing well. Thanks for having me today.
Dude, pumped to do a catch-up show with you. You know, it's been a bit since we've had you on the show. You know, you've the newest doctor here, but now you're an established veteran here at Head to Toe.
Veterans pushing it, but I mean, yeah, we're still like less than a year in, but I am getting a lot more comfortable, and it's nice to see patients coming in through the door and like actually requesting to see me.
Yeah, building up your practice, and you're
fun.
kind of following.
Absolutely, yeah.
And it seems like lately, you've been seeing a lot of athletes.
Yes, yeah. So a lot of high school athletes, like some collegiate athletes, even like some like
Pro-Am.
Yeah, Pro-Am.
NDA in effect. Can't mention any names.
Exactly. Yep. HIPAA. You know, got to protect the anonymous.
They have to be. Yeah, exactly.
Anonymity.
Yep. Yep. Yeah. We can't. And plus, you know, they might be a high performing player. They don't want to get their secret treatment center out there. We could be your secret treatment center.
Yeah.
If you're listening to us out there, pro athletes. Yeah, but that's kind of full circle for you, right? Weren't you kind of one of the reasons you got into chiropractic back in the day? Absolutely.
So a lot of my injuries, like coming back from high school, like were sports related injuries. So whether like on the wrestling mat, mainly pretty much on the wrestling mat, dislocated ribs, dislocated shoulders, going into the chiropractor, not really knowing what they could offer, but then always walking out feeling a lot better and then performing at a higher level than I was prior to like the injury. So it's been nice to have that come full circle and then being able to give back with all the knowledge and all the answers to the questions that I had when I initially went into that first visit. You'd get hurt and you're walking in and like my shoulder hurts. It's like, okay, well, let's look at like everything but the shoulder and see what's going on. And you're lying on that table. You're like, wait, so how is this actually related to my injury? So having that come full circle and like learning all that and being able to give back and give that knowledge to these athletes and kind of educate them about their pain and educate them about their bodies and how everything, is one fine-tuned machine and everything works together. So
that's the thing my guess would be, and again, I haven't been in the patient room with you having these conversations with younger athletes, high school, collegiate level athletes coming in, but I can just say from my own personal experience with being in CrossFit and functional fitness or whatever, times where I've gone injured, you think about a spot of injury. You think, oh, it's a shoulder issue, or it's my hamstring, or, it's this one particular area that you're maybe feeling pain or you have mobility or whatever. And yes, there is stuff going on there, but to your point, it's connected to this whole system that you have as a body. And that's oftentimes the insight that's missing, I think, for a lot of people and athletes is how connected everything is.
Absolutely. Yeah. You speaking as like a shoulder, for example, it's like, why is the shoulder the one that like took the brunt of that injury? Like, what were you doing? What kind of like demands were you placing on your body? What was fatigued prior to that the shoulder was the one that gave away? So looking kind of macroscopically, looking at the whole system, checking in on those lats, checking in on the core. I mean, core, we can just probably have a whole episode about how important your core is and how straight.
And we should.
I think, how a strong core can literally improve the functions of all your limbs, right? I like to use the analogy or like the imagery of like, when you're like hanging up a shelf on a wall, you're looking for that stud. If you miss the stud, that shelf's going to fall. Your core is that stud. So if it's not solid or stable, then things are going to start falling apart a little bit. And that's that's a whole nother episode. But yeah, looking at everything and being able to educate, I think, these athletes about their pain is a really cool and powerful tool.
Yeah, because you look at the body as a system. You have areas that might be too tight, areas that might be too loose. You might have kind of past injuries that have created some scar tissue or some mobility limitations that's now caused compensation issues, right? So like different parts of the body are working harder than they need to be, which then over time sets a person up for potential injury.
Absolutely.
So part of what you're doing with these athletes is kind of helping bring that perspective and awareness to their whole system.
Exactly. And they were letting them tell their story, what kind of past injuries have you had? And like kind of starting from that, like that first injury that may have set off this like chain of events to get them to where they are now. And almost like going to that first event, being like, okay, whoa, you rolled your ankle and now you have low back pain. And like, did you ever treat that ankle? No.
Chances are no. Yeah.
And then that like set off a whole cascade of events going up to your knee and your hip and your back. So it's like being able to fix that initial like problem and then seeing like the results as they play out.
Man, it's interesting too, because I think especially for high school athletes, there's a little bit of an illusion of being young and being invulnerable or whatever, or feeling like you'd bounce back from things quickly.
Absolutely.
Or you heal fast, so I don't really need to go in to see anybody because I'm going to feel better.
Mm-hmm. And they do heal fast, but sometimes they just need to shove in the right direction. I think also there's just a lot of, I wouldn't say like miseducation, but like a lack of education, where it's like, yeah, you get hurt, instead of just dealing with it and letting your body kind of like heal on its own, go and see someone, come in, get checked out.
Okay, you bring up something great. It's like, because there's definitely, I think, an argument for like the wisdom of the body and all that. But to think that, okay, it's like this: if you break a bone, depending on the severity of the break, yes, your body can heal that break, but that's not going to say that it's going to heal it straight. That's not going to heal it. It's not going to heal it in a way that it like continues to function the way it functioned before that break. Mm-hmm. And so that holds true for like ligament, tendon stuff, like muscle sprains, tears, like all that stuff, right? Yes, the body can heal itself, but is it going to heal itself in an optimal way, or in a way that's going to even allow you to perform at or above the level you were before the injury? That's what you got to be thinking about.
Yeah, probably not.
Probably not, because really, the body's just trying to get the work done. It's
exactly.
Not like, you got to think the body's like lazy. It wants to exert as like few resources as possible.
It's going to start laying down tissue. Doesn't care what it looks like. It's just like, we got to heal this. We got to close that bridge.
Exactly.
And then there's scar tissue, and then there's tension around that, and that's going to start pulling from all the different directions, and that's going to cause dysfunction elsewhere. And you don't think about it until you're in your 30s and your 40s, and like, wow, yeah, back in the day I rolled my ankle, or back in the day I like fell off a diving board, hit my head, or whatever. And it's like those things will come back to haunt you if you don't treat them now.
Real life story. My wife's mom just had knee replacement surgery done from an injury she got skiing in like college, basically, that she's never addressed, and had all these issues that she's dealt with all this time, and finally to the point where she had to complete like knee replacement surgery. And that's something that she could have gone in and gotten work done on years and years and years and years ago, and that would have had a massive impact on the quality of her life over those times. So,
absolutely.
Don't wait. But out there for your I think another thing that you were talking about before we started the show was that you also see a fair number of these kind of younger kind of peak power form, in that high school and college level athletes. You also see people who are just coming in from an injury prevention or a performance optimization standpoint. Mm-hmm. Talk to me a little bit about that.
Yeah, so got a couple of patients coming in, just not really any like major aches and pains, maybe even like post surgery or something. Still feeling better, getting back into it, and they feel off. And that's kind of the word that you can use to describe it, like feeling like body's not optimizing or not working together, not communicating. So looking at the demands of that sport, say like baseball, for example, a lot of throwing, a lot of twisting, a lot of rotation. For basketball, you got a lot of like cutting, jumping, pivoting, things of that matter. So like, how can we train that outside of just playing the sport, which I think is like probably the number one way that you should train it, just reps, right? But how can you do that outside of that, like in the gym, and how can we like get those tissues to adapt to the demand that you're placing on them, and get things to start talking to each other and communicating and working together, so that you can be more functional and avoid injury in the long run.
That is a powerful thing to think about right there. Yeah. If you're an athlete, how do you, get partnered up with a professional? And that's kind of what we're doing here, and what you're doing in this case, to assess, the type of movement patterns that you really need to be working on, where you're most either vulnerable for injury, so they need like extra work there to prevent that, or on the flip side, that needs to be conditioned in some unique and specific ways in order to enhance like your performance then when it's game time. Mm-hmm. That's powerful, man.
Yeah. I mean, how many times, even in your past, or like even in my past, like, those first 2 weeks of practice, you you've been sitting on your butt on the couch playing video games all summer. Then you go back to practice, and it's like, all right, we're running sprints, we're doing drills, and those first 2 weeks you're wrecked. Like, and maybe that's when you pull a hammy, roll an ankle, do something dumb, and you're like, why did that happen? Well, so you're all of a sudden you went from 0 to 100. You never gave your body a chance to ramp up and get used to those demands, and that's when the injuries happen, right?
And you weren't doing anything like along the way to make sure that didn't happen. So if you're going to go 0 to 100, like you need to have some pit stops like in there, like where you can quickly come in, get some adjustments done, some work done, make sure anything's not, because sometimes you need a person to tell you like, yo, you have to dial it down.
Slow down. How many times do you see people like in the new year, like resolutions, go to the gym, and they haven't been doing anything, and then now they're in the gym pushing a bunch of weight, and it's like, well, when's the last time you worked out? A couple months ago. Or people that are starting to run, it's like, yeah, I just ran 3 miles for the first time in like 6 months, and my shins hurt. Well,
it's anytime anyone, this is so common, because one of the things I like to always remind people is like, yo, there's different seasons of life, so you could been in a season where you were very fit, very active, maybe you were worked up to like a lot, like long distance running or fast speeds, or like you were heavy lifts, or when I was in the CrossFit world, I would see this all the time. People would come back in, they had been out of the gym for a number of months for whatever reason. They come back and they just try to go back to what they were lifting before.
Yeah.
And they almost always get destroyed, right? And then they could get re-injured, or injured in their first month back.
Yeah.
But they also feel this like massive sense of failure, and like, oh God, I just can't wait to get back to where I was.
Exactly. And I think that's part of the education piece that we also give when you come in. It's like, be patient with yourself. Allow your body time to adapt and get used to those loads. I always like to tell patients when they come in, like, the work we're putting in this month, like whether it's soft tissue work or the exercises that we're giving, you're not going to see that right away, but like you'll see that a month later. And the same goes for diet. Same goes for any kind of like lifestyle modifications. I like to think like, give the body time to adapt. Give it a month. Stick with it. Be patient, and then see those results.
There's always a little bit of that lag time.
Yeah.
And it can be frustrating because then it feels like, well, why am I even doing this? Well, you're doing it because those small steps that you take today produce those results that you experience over in the days to come.
Yeah, and we live in, the society where it's instant gratification. We want to see those results now, post a picture, you get a like on Instagram.
Boom, push buy, shows up a couple hours later.
Exactly.
It's like, but the body doesn't really react like that to most things that we want to achieve.
Those tissues take some time to turn over,
and to be like repatterned. I think one of the other things that you do so well with athletes is looking at their movement patterns that aren't efficient or aren't effectively firing. That's one of the things that I think you've talked about seeing in athletes is like where they're overcompensating maybe for just underdeveloped or ineffective like muscle movements.
Yeah.
So you might have parts of the body that are weaker than they should be, so you can do some targeted activity to boost strength and kind of get those muscles to turn back on and sequentially fire properly.
Exactly. Like the ineffective fire pattern, I think that's huge. And sometimes like I'll tell patients like, you're not weak. Like that muscle's strong. It's just not doing its job when it should be doing its job. So going in and like refining some of those movements, getting that glute to fire first, getting that lat to pull before these other little muscles that are going to like end up firing and doing their jobs kick in. It's just that exactly like you said, like that effective like firing pattern is huge. And then when those big muscles fatigue, then those little guys can come in and do their jobs. But you want those big prime movers to do it first.
Yeah,
and
absolutely.
If they're not active, then we can develop bad habits, and then
And then the next thing you know, your promising career is cut short by a shoulder blowout or some other like career-ending injury. And that actually does happen, unfortunately, more than it should. So if you're a parent too, if you're a parent and you have like a student athlete, you have someone in athletics in your life, and that it's something that they either want to pursuing as a deep passion, or they have like an academic kind of a future-oriented interest in it. Like, hey, they want to go to college for this, or they're in college and they're currently performing athletics. This is absolutely essential. It needs to be part of the plan. Get them in and let us assess whether they have a reoccurring injury or old injury or current injury, or just some sticky points that need work, or just some analysis, some movement analysis, and some maintenance and some exercises and activities that we can give them, right?
Yeah, and I think some education too. I mean, I look back at myself my senior year of high school and like dislocated a shoulder, went into baseball season, couldn't throw a ball. It never crossed my mind to go rehab it, go work on it, go like strengthen that shoulder. Instead, it was like, I can't throw a ball. I guess I'm not playing baseball. And like looking back at like all the knowledge I have now, I'm like, oh, like if someone just would have told me I could have done this, then I would have immediately done that. I would have been like the most perfect patient and like done anything anyone would have told me to do. But instead, I just lacked that knowledge and that like awareness that this is something I could actually work on and fix.
God,
So
man,
yeah,
we've all been in that spot. I think especially at that stage of our life where it's kind of funny because one, you think you're invulnerable, you think your body's going to heal, like, you know, the power of youth. But you also kind of think you know everything, even though you don't know, and like you know nothing basically. So it's like if you don't know it, it like doesn't exist. Well, the reality is like, oh man, if we can get to more of those kids out there who, you know, whether it's just a passion, something they really want to do, or whether it's something that they want to move forward with and pursue like at the next level, it just sucks when that option's taken away because they didn't realize that there were therapies, treatments, and people out there like us who kind of specialize in this.
yeah.
To help them go back and do the thing they want to do.
And absolutely want to be involved and like want to give back. I think it's like you said, coming full circle. It's just nice to be on the other side of that table and have the answers to those questions and be able to educate these student athletes or athletes in general, even like the weekend warriors. Be like, hey, like, yeah, you're feeling a little bit of pain. It's not the end of the world. Like, we can work through this together, and we'll get you back there stronger and doing the things you love.
I love it. So, well, listen, if you're hearing this and you're an athlete yourself, or you know you're a parent and you're hearing this, or you're a former athlete and you're looking back at your own life and you're realizing like, damn, I have some stuff that I never really got taken care of, and it's still plaguing me to this day. You know, we're here for you. That's what we're kind of experts on in making sure that we get that stuff corrected. And you know, James, appreciate the work you're doing with our athletes out there and helping these young people like be their best and have a bright, full, functioning future in front of them.
Absolutely. Yeah. It's been fun. It's been fun to give back, and I'm excited where everything's going right now.
Absolutely, man. Well, thanks for being on the show. Until the next time, keep those sport athletics moving, keep doing what you're doing, and remember that movement is the best medicine. Thanks, everybody.